The Africa Center of Excellence for Water Management was established to develop skilled human resources capable of handling water management problems of Africa. The center, based at Addis Ababa University, was established in 2016 with the support of the Government of Ethiopia with World Bank credit as part of the ACE-2 project. It aims to produce excellent training and applied research that meets the demand for highly skilled personnel. The center offers internationally accredited master's and PhD programs in water management with various specialization tracks. The center has hosted 118 MSc students and 77 PhD students from at least 10 countries since its establishment in 2016. David Werr researched carbon storage and emission of carbon in wetlands in Uganda.
This study assessed the storage of carbon and also emission of carbon from these wetlands. And for the carbon, both carbon and storage and emission, we're looking at a natural wetland which has different communities and also a converted wetland which has been transformed from a natural condition to a rice paddy condition. So when we looked at the carbon storage in the natural wetland alone, we observed that carbon storage was highest in the section dominated by papyrus compared to taifa and phragmites vegetation. But also when we looked at the impact of land use, that is the natural and the rice paddy, we observed that the natural wetland stored more carbon than the rice paddy wetland, meaning that if you convert a natural wetland, then you reduce its ability to store carbon.
The center itself is good at mobilizing resources, including experts from abroad. So to compare to this particular center, I think it's somehow closer. I'm wondering, I feel like I'm at IHE of the Netherlands when I'm here. Because, the thing is, the follow-ups they make here seems like push you to be time-bound in progress, be it a coursework or research.
The focus was to know if this device is effective against this parasite. So, yeah, and the research was done, and finally it was known to be effective and can be used for schistosomal control.
5 years on, the center leader says the teaching and learning has gone smoothly, except for the COVID disruption.
The teaching process is going smoothly, and we have really our faculty members, affiliated faculty, adjunct professors, they are very much interested to work in this center because we try to make the learning teaching process suitable to academic. We try to create a good academic environment. We try to provide efficient service. We have support team. So overall, I'm quite happy. But the COVID has become a challenge. But I hope it will end.
The center offers demand-driven short courses in water management for professionals working in the water sector.
We have a fee structure depending on the nature of the course and the duration. So we charge. That's one of our main source of income. Nothing is free for free, but we always make sure that the quality, the delivery of the course is to the satisfaction of the training and those supporting those trainings, the institutions.
The center is fostering partnerships with other academic institutions and the industry to produce innovative solutions.
The World Bank support program helped us to establish partnership. So we managed to build partnership, both academic and sector organizations. So concerning the academic institutions, we work with universities in the north and south. Concerning the sector organizations or partners, we work with the Ministry of Water, Irrigation and Energy, Ethiopian Institute of Water Technology, and the Ministry of Education. We increase the visibility of the center.
We have an exchange visits as our staff involved here in teaching, like myself, and also students from the center will have an apprenticeship program with our commission, and they're sharing practical experience from our commission. So the other one is again prioritizing topics for this PhD or this MSc students, so that those topics can contribute directly to the real problem that we have on the ground.
With regard to financial, we are working with the center, I myself as a partner, and soliciting different funds, applying in a different organization. In addition to this, with my university, Jimma University, now I try to establish a mini kinds of field research by bringing students. For example, currently I have a Rwanda student traveling to my university in Jimma, is doing constructed wetland. So that also strengthens not only Addis Ababa University, but Jimma University also.
Working with partners, the center has identified key areas for research and outreach community programs. An example is the School Water Project.
We have at least 9,000 or 10,000 schools in Ethiopia that have no water supply, but we have plenty of water, at least the groundwater. We approached the ministry to look for shallow groundwater. We have expertise here. And we initiated that project through a consultative process, where, how, in a phased manner, who will do it, what are the deliverables, and when the schools will be able to get the water actually.
With the financial support of GIZ, the center is working with the Environment, Forest, and Climate Change Commission to develop standards to manage wastewater sludge.
Most industries in Ethiopia are discharging waste without proper treatment. In some cases, or recently, it has become a requirement to treat their waste before discharge, and even to the extent to recover the water. That is, they have what they call zero liquid discharge, which resulted in, when they recover all the water, then they have residues. Everything in the water, in the wastewater, becomes residue. So we advise them how to manage this residue in case of municipal, so we can use it as a fertilizer.
Together with the Imperial College London and the National Health Research Institute in Tanzania, is also implementing the water infrastructure for schistosomiasis endemic regions, or WISER project.
Schistosomiasis, or we call here in Ethiopia is bilharzia, is among neglected tropical diseases. It has been persistent in many African countries, especially Eastern and Southern African countries. So the project has different components: how to detect the parasite in the water, and again how to treat water for human use. So people are exposed to this, to this parasite or worm due to contact. If there is no, this bilharzia-free water, then we cannot just simply advise people to protect themselves. So we have to find a low-cost treatment system. There will be filtration. Then people can use somehow treat until, in the future, this the sanitation gap and the cycle of such parasites become, the problem gradually going down.
ASWAM is also implementing One Health, a concept that brings animal health, human health, and environmental health together.
We won a research project, a research and capacity building program. It's a NORAHED 2 that is supported by NORA, Norwegian government. It's a highly competitive program. It has different components. We have partners in Malawi, in Norway, and partners here in Ethiopia. So it's a 20 million kroner project, NOK project. So we are trying to establish the idea of a new concept, relatively new area, that is One Health approach. So we see water as the center of all sustainable development goals. So be it health, food security, energy, livelihood, aquatic ecosystems.
Through this initiative, the Center is bringing to the forefront the contribution of water in achievement of SDGs and the role of water to achieve a One Health initiative.
We are trying to incorporate this into our research programs. The One Health approach has 9 work packages involving different experts from different fields, and we have One Health in master's program in One Health and a PhD program in One Health, and we have also postdoc program. 40 MSc students, 7 master PhD students, and 3 postdocs, and a number of experts will be involved in this project.
The next milestone for this center is to secure its sustainability and stand on its own beyond the financing of the World Bank, which will wind up soon.
The center will be sustainable as long as we are given the privilege, the autonomy. Okay, we are operating now. So we have the efficiency, recruitment of students, faculty, procurement, finance, and so on, and revenue generation. So this is a very unique setup. Under this unique setup, it works well, as long as this arrangement is there. If this arrangement is not there, then that is a problem.
Dr. Zoga's proposal to the Ministry of Science and Higher Education as the National Steering Committee Chair is to adopt the ACE2 financing and governance model. If autonomy or semi-autonomy is granted to academic institutions, he is certain that there will be higher efficiency and excellence.